We made an initial contribution of $1 million, followed by $7 million, followed by $10 million, and today I announce an additional $24 million, which will further ramp up our response in West Africa. As you also know, we have been in consultation with our friends and partners for some time. We have been particularly concerned that any Australian personnel going to West Africa should be able to access appropriate treatment and evacuation procedures. In the last few days, we have had assurances from the United Kingdom that they would treat any Australian who is working in the Ebola-impacted parts of West Africa as though he or she were a citizen of the United Kingdom. So today's announcement is that we will commit up to $20 million to staff an Ebola treatment centre, a 100-bed Ebola treatment centre in Sierra Leone. This will be a centre that's being built by the United Kingdom, but it will be staffed by Australia through a medical provider, Aspen, an Australian provider. Most of the staff will be locally engaged. There will be some international staff, and some of those are likely to include Australian paid volunteers. We're also committing some $2 million to Red R, and this will be for Australian logistician volunteers to work with UN agencies such as the World Health Organization to provide logistics support for the Ebola teams in West Africa. Most of those staff will not actually be based in country, and there'll be a further $2 million to enhance the regional preparedness. We'll be using that money to ensure that health staff in countries such as Timor-Leste and PNG receive the appropriate training to deal with any Ebola cases there. My anticipation is that Aspen will have some staff on the ground in Sierra Leone within days. My hope is that this treatment centre will be operational by the end of the month, although we will to some extent be dependent on our United Kingdom partners who are actually building the centre that Australia will ensure is staffed through Aspen. We're also ramping up our domestic preparedness because I stress the last thing anyone would want to do is to have personnel going to Africa, coming back to Australia and acting as carriers for this horrible disease. I think the Australian people expect our priorities to be prevention at home, preparedness in the region, and work in the wider world. And that's what we're doing as part of our campaign to be the very best possible international citizen. We anticipate that there'll be about 240 staff required to do the job. Most of them will be locally engaged, some will be international, and it's quite possible, even likely, that some will be Australian. But Aspen will be looking after, with the assurance of the UK government, Aspen will be looking after any treatment or evacuation that might be required for international staff working in this treatment centre. And I stress, this is a health emergency. It's not a military emergency, for instance, which is why we've contracted a private health provider to do this, which is in keeping with our response to other overseas health emergencies such as cholera in our region. It's entirely in keeping with those sorts of precedents.